This is Dr. Goel, Goel, MD, Medicine and DM, both from India and from US. At present, I'm in US and practicing in US. Today, I wanted to tell you the blood test and other important tests associated with the heart, especially when we want to rule out heart attack. So, one of the tests which show like increased risk of heart attack are one of the test is HSCRP, high sensitive C-reactive protein. It is a very important test and it helps us to assess the risk of the heart disease or heart attack. So if level is more than 1 milligram per liter, then there is an increased risk of cardiovascular event or heart attack. And if this enzyme goes more than 3 milligram per liter, then there is a really high risk for heart attack. Once again, the name of the test is high sensitive C-reactive protein. This is a very useful test. Thing is कि at this early stage, other tests and symptoms may not be useful. So this enzyme is actually made by the liver, and it made in the response of the inflammation or infection in the body. And like I said, if there is a low risk for the heart is less than 1 milligram, and there is a average risk is more than 1 to 3 milligram per liter, and if there is a HSCRP is more than 3 milligram, then it's definitely a high risk. 3 milligram per liter, there is a high risk for the heart attack. High cholesterol also, high low density lipoprotein is definitely increases the risk of eventually heart attack, blockage of the heart arteries. Two tests, troponin T and CKMB. So these are more like heart enzymes, and if they are increased or they start rising, well, they actually predict you are having a heart attack. During the heart attack, we specifically test, if we suspect heart attack, we especially test troponin T and CKMB, and if they are high, yes, we strongly believe the patient is developing heart attack and we treat him as such. When heart muscle is damaged during the heart attack, both troponin and CKMB are released in the blood, and along with that we test for hypoprotein and homocysteine. So all these tests predict the risk of heart attack or actual heart attack or heart damage. To summarize, most important blood test for heart or risk of heart attack is high cholesterol, LDL, low density lipoprotein, and CRP, C-reactive protein. If it's increased, it does indicate there is some inflammation. Two tests which are very specific to heart are troponin T and CKMB. When they are increased, they actually reflect the heart attack and heart muscle damage. Besides, we know that ECG also shows some changes during the heart attack, or even we are having a decreased blood supply to the heart. And then there is another 2D echocardiogram which also tells us we can look at the heart and its walls. Then we do stress tests also. And then the last ultimate test is the coronary angiogram, when we inject a dye goes into the heart blood vessels and we take all the picture. It clearly tells us which arteries are blocked and how much they are blocked or they are not blocked. So this is about the tests related to our heart. Thank you so much. And in healthy heart we use basically ECG. ECG is normal and there are no symptoms as such. We believe the heart is healthy. Thank you.